Hello, buddies. Yeah, are you all excited for the session? Me too. So, today we are going to see on the current trends and issues in nursing. So, being a nurse, we have to be updated on the current trends as well as the possible issues and how it can be solved. So, going into the slides. So, here, starting with the current issues. Mainly, the issues is due to the development of the nursing career, might be based on the societal images and expectation of the nurses. So here the expectation of the nurses in the sense, like some of the nurses are part to even like they are doing the career training and specialization and so on. So that is a recent trend. Like olden days, they were only having a nursing education where only they were given training or something like auxiliary nursing or midwife, and might be it is a 1 year or 2 year course. But nowadays, you can very well evidently see that there is a baccalaureate program, that is Bachelor of Nursing, as well as master's programs such as MSc in nursing, and as well you also have MPhil and PhD and so on. So the degree of nursing profession is control over the quantity as well as quality of practitioners. So this will help or aid in giving a standard of nursing lectures or maybe nursing care to the patient, or in the teaching fraternity. More hands-on training will be given to the students as well. So thereby we can see that this trend is actually giving or improving the quality in nursing. As well, it has, you can evidently see that the impact of technology and theory of nursing practices, it also has its own roles and settings. And we all are very well expected, as well as it is also creating a major self-image on the nurses, such as they are getting many cadres nowadays. You can see that olden days when they were called as staff nurses, so nowadays you can see evidently in the central government that they give a ranking such as nurse officers, cadre 1, 2 and 3, as well as the nursing supervisors, deputy nursing supervisors, the CNO and so on. So it is indirectly as well as directly improving the image of the nurses, and it is also upgrading the nurses. And there are certain sources of financing for healthcare services as well in the trends you can see. So now what are the major factors which affect the nursing practice, or the issues that affect the nursing practice is that starting from the demographical changes. So demographical changes is nothing but we all know that it is might be the patient's age, name, sex, the group they fall in, maybe it is a pediatric, geriatric and so on. So the first point is dealing with that elderly people are mostly at risk for developing infection and diseases. So we the nurses must be predominantly going on to the preventive aspects for the elderly people, such as preventing of fall or preventing of all the loss of senses, such as you can screen the hearing capacity acuity, and we can give some hearing aids, or might be if they need for assistance, might be using walkers or cranes or canes or crutches, can be intended to that particular geriatric person, and we can prevent so many illnesses among the elderly people. So we have to be we the nurses have to be very much readily prepared to combat those risk people in future. And the number of people living below the poverty line, so that is also going to be a challenge to the nurses. Why I state this point is that, like the basic fooding as well as clothing and shelter, when it is already unmet, and how is the person going to come to the healthcare setup and get the treatment done? It is really another big question. So, food, clothing and shelter, when it is not met, how can a patient can be affordable to meet the healthcare demands? That's really another big question over there. And then coming to the immunization, like as I told you earlier, preventive aspects, care for AN mothers, such as you're giving some health teaching or you're giving some preventive, or like giving injection TT, expo and screening for HIV tests and so on, as well as nutritional means for all the under 5 children and maintaining the factors that are being neglected. So that is also quite a big issue when we see in our nursing practice. So the next important thing which can be another challenge to the nurses is that poor people, they often don't go and seek for any sort of disease ailments when it comes into existence. Like for example, a patient may be developed or developing diabetes, or he or she might be in the primitive stage. He is not go- he is and with evident all the symptoms, not going earlier to the healthcare, but he or she will go unless there is a ulcer formation or cellulitis or might be a major complication, and then they go and meet the healthcare facility. So hereby what happens is that the person is not actually going in for a preventive or might be a therapeutic aspect, but rather than he or she is being pushed for advanced diseases like complications. After developing the complication, they come into the nurses area or might be into the healthcare sector, and then they get treated. So that is also quite another challenge among the nurses during their practice. And preventable conditions are always not prevented, might be due to lack of education to the patients or might be to the community as well. And if the community is having a very improper sanitation, or they are living in a very crowded area like Mumbai and the North Chennai and so on, and improper shelter, homeless and so on. And another challenge or maybe another issue in during nursing practice is that we the nurses are going to give care to the patient irrespective of the social background and the economic background of each patient. So yes, before going into the details of what are the major trends and issues, what can be the other possible factors? Yes, the other possible factors is due to urbanization. So one aspect you can see that urbanization is like you're going to develop the city, going to develop the town, or you're going to expand the town, and you're cutting down the trees, where it can also cause environmental hazards, and you can see the ozone layers being opened, and that's why we also develop certain skin disorders and so on. And due to the urbanization, there is reduction in the rural development as well as reduction in the agriculture, where many persons are going homeless and some persons are being influenced by the drug addicts. So the drug is also playing a major role in physical as well as mental issues in all the persons who are using it, and that is also causing a major violence, or might be because of the usage of drugs the client is developing crime and so on. And the second important factor which is quite challenging during the nursing practice is that the environmental changes. So as I told you, even when we try to control the modifiable risk, which is the non-modifiable risk, which is the demographic variable, here the environmental changes also play a major role. That is the nuclear power plant accidents or any burns in the wells, oil wells, or might be a great disaster such as tsunamis. Might be there is you can see that there is changes in the air as well as water, and plant and animal life is totally depleted, or it is getting totally distorted. So environmental changes also plays a significant role in nursing practice. And changes to healthcare practices, like for example, obesity is mainly due to unhealthy dietary habits by the patient, or might be due to very busy, always lack of exercise, or might be is always being put up into a physical or mental or emotional or spiritual stress. And might be also for example, nowadays we can see that HIV incidence is on a higher rate due to the contact with many multi-partners. So hence we have to give the adult education during the adolescent period. The school children must receive what are the do's and don'ts and how it can be prevented. And substance abuse also play a major role, and it is also a big challenging towards the health practices as well. Nurses, the fourth important issue in nursing practice is that emerging bioethical issues. So due to the vast new technologies and advances in medicine, we can expect to the exposure to issues related to birth, or might be issues related from life to death. So issues related to birth in the sense might be the patient getting developed, or might be the AN mother not getting treatment during conception until the delivery, which leads to birth complications as well as intranatal and postnatal complications. And the issues that is relevant to life or death is that when the patient is being undergoing any hemodialysis or peritoneal dialysis, or if the patient is being ventilated by a heart lung machine, or might be in an ECMO protocol, or might be an organ transplantation, or might be the genetic and fetal research. So last but not the least, we have the nursing, the current trends in nursing education is that it is now, as I told you earlier during the introductory phase, that is the education is vast, and you can see in the picture evidently like starting with the just from an diploma and then changing into BSN and MSN, which is Bachelor of Science in Nursing, and Masters of Science in Nursing, where we can excel in many of the cadres. So here it is actually intensely you can get set up in an acute care, as well as we'll be able to have the right decision making during the clinical setup whenever we deal with any of the patients complications, or might be patient complaints, as well as we'll also have a coordinated with the less skilled workers. We'll be able to get the help from the less skilled workers into the work and accomplish the work in a situated way. And you can also see that always there is a collaboration of the patient and healthcare professionals to improve the quality of health. Last is that we can see that nursing is no more a full stop just behind just only with practice. We also go in advanced technologies such as doing nursing research. Might be the research is based on education aspects, or might be during the nursing service aspects, and whereby we can improvise our nursing fraternity as well as the patient care. So this will accomplish equal evaluation of professional practice. And I would like to thank you all for your patient listening, and stay tuned to look on for more videos. So thank you so much. Please don't forget to like, subscribe and comment. Thank you.